poor scalp microcirculation is a cause of hair loss. Reduced blood flow limits nutrients and oxygen delivery to these follicles. So when you vasodilate the scalp and then you do your stem cell exosome microneedling procedure, you can use physiological changes to produce the most desired results.
What do people need to be looking out for, to be wary of in the peptide field?
Are you tired of all those hair loss treatments and products that claim to work but don't? My name's William Gaunitz, and I am your no frills, no BS certified trichologist that is going to help you understand how to tackle your hair loss and actually regrow hair.
Hello and welcome to another episode of the Trichologist Podcast. My name is William Gaunitz. I am your no frills, no BS certified trichologist who is really trying to bring you the best of what's happening in hair growth today. And we have an absolutely phenomenal guest who's going to cover some amazing things about peptides. And we're diving into the world of peptides, what they are, how they are going to work, and really, can they stimulate hair growth? Because as a practitioner, I get this question all the time. What do you think about peptides? So we are going to ask the expert. And today's guest is one of the most respected and innovative minds in longevity and regenerative medicine. Dr. Kuo is a double board certified physician who's treated over 50,000 patients, built a long-term reputation with celebrities, elite athletes, and CEOs. He's earned an MD from Boston University's prestigious 7-year program and trained at the Medical College of Cornell. His latest venture, Extension Health, is where things really truly get next level. This longevity clinic offers advanced diagnostics, groundbreaking treatments like plasma exchange, ozone therapy, exosomes, peptides, and hyperbaric oxygen, all under one roof, which is phenomenal. And he's worked with legends like Troy Aikman, tech entrepreneurs in the Musk family, as well as some other very, very respected physicians like Dr. Mark Hyman. Dr. Kuo has become the go-to destination for those seeking to optimize performance, reverse aging, and transform their biology at a cellular level. He's not just prescribing these protocols, he's actually living them. After facing his own battles with fatigue, as well as metabolic dysfunction, Dr. Kuo became his own patient, refining the same methods he's now offering to his clients. And I personally have an experience with you at the Brian Johnson Don't Die Summit. And you were so kind as to take the time. And actually, I had torn shoulders and a torn hip labral issue. And you sat there and you actually took the time to go over all the things with me. And I presume that's how you treat every single patient. And that is respectable and commendable. And I really respect what you're doing. So let's get ready to dive into personalized medicine and the science of peptides for hair and health.
Thank you so much for that introduction. It's a great honor to be on your show. It's lovely to meet you at Don't Die. And I'm excited to dive into how peptides and hair recovery and growth can be a synergistic thing.
If you love this podcast, please go ahead and subscribe to whatever channel you're listening to it on, as well as give it a 5 stars. Leave some comments. We're here to answer your questions in future episodes. So please go ahead, leave us a comment, subscribe to that channel, and give us a 5-star review, and I'd be greatly appreciated. Let's get into the meat of peptides for hair growth. You are doing some really, really unique things. And I mean, from basically the clinic that you've established, can you kind of go in and explain to our listeners what it is that you are trying to accomplish at Extension Health, and kind of how did you get there? How did you decide to put all these things together under one roof?
Sure. Yeah. I mean, Extension Health is a longevity clinic. What I think we're best at is some of the kind of more advanced longevity therapeutics out there these days. How I got into this was, I started off my background training and I'm a double board certified anesthesiologist and an interventional pain specialist. So I spent the first 15 years of my career treating patients in chronic pain. Actually, we built one of New York City's busiest interventional pain clinics. And so by treating, over 50,000 patients over these 15 years, we've kind of learned a lot about how chronic conditions continue to progress and evolve. And through that lens of treating these patients, I'm always trying to figure out how we can better treat them, how we can kind of address some of the root causes. And that really led me down the route of regenerative medicine around 6 or 7 years ago, really starting to use a lot of PRP, exosomes, stem cells, and various kinds of, joint injections, tendons, ligaments, stuff like that. Thinking about regenerative medicine, it's really kind of trying to encourage your body's own natural ability to heal and recover. And so that, led me down the route of peptides. So, we really got into peptides 4 or 5 years ago at this point. Peptides really represent a very exciting new field in medicine, as in they are, this kind of novel class of medications that can really augment your body's physiology and really kind of treat things at the root, cellular medicine, cellular physiology, kind of root-based cause. And then from there, peptides and the whole kind of, the other therapeutics that we offer, such as the, plasmapheresis and the ozone dialysis or EPO, hyperbaric medicine. And so these nervous system resets really just work on basic cellular medicine and physiology. And that's kind of just what we call longevity medicine, just as a total. That's like kind of my interpretation of longevity medicine, where we're really trying to look at, the 3 basic systems: your body, your mind, and the resilience of your body. All right. It's really simplifying it down. It's those 3 concepts that we work on optimizing together. You're looking at the body in a holistic manner, really trying to figure out how to make the cells and the physiology work their very best.
Well, and with all that, so let's hypothetically say somebody comes in and what is your typical age bracket of somebody coming into the clinic?
We see patients of all age ranges. I would say at this point, a lot of people really come to us for optimization. Okay. Yes, sure. We do see, complicated medical cases that, we're kind of a tertiary referral for a lot of these complex medical issues. However, a lot of the same treatments apply to people that are actually just looking for optimization. And so I would say that, 40-year-old, 40 to 50 to 60-year-old age range, we have a lot of, professional athletes and executives and CEOs and just people really trying to take it to that next level. Okay. Most of these patients are, honestly pretty healthy. All right. They're just really looking for that extra 20% unlock that you can't necessarily get with, optimizing the basics of diet, sleep, and exercise. So we're that little cherry on top. How much can you really unlock? How much extra human performance can you get out of medicine, out of new technology, out of, optimizing your physiology and your biology?
Sure. Well, and that rolls perfectly into the hair growth scenario because it's, how do you optimize the hair growth? There's so many things, especially, with advanced trichology where, we've spent a lot of time optimizing, sort of biohacking the internal portion, getting the right nutrients in, managing DHT, especially topically and internally, and particularly inflammation, and trying to manage that from a gut health perspective, but really optimizing the sort of growth stimulation and allowing for your body to heal to a level that it's probably not capable of without this. It sounds like that's kind of where your sweet spot is.
Yeah. I mean, peptides can be really helpful for hair growth. Certain peptides can stimulate hair follicles. They can improve scalp circulation. They can reduce inflammation. All these things are kind of key to promoting healthy hair growth. We can kind of go into the specific peptides that you can use for this. Things like GHK-Cu, like BPC-157, thymosin beta-4. Even some of the growth hormone stimulating peptides can help. Activating follicular stem cells, promoting angiogenesis, new blood vessel formation, reducing the inflammation around the hair follicles, supporting collagen, the extracellular matrix and the repair, and then modulating your growth factors, right? Your endothelial growth factors, your VEGF, your IGF-1, and also this WNT signaling pathway as well. So you can use them topically, microneedle, through localized injections, and also just part of regenerative medicine hair loss protocols.
Well, and we'll get into some other really cool stuff that you're doing. But for those people who don't know, what is a peptide? What is something that is, relatively new? I remember peptides from back in the day using, I think it's that sort of like thymo skin or whatever, the copper peptides topically that were they were actually changing the color of people's scalps and hair and turning them blue. This is not what we're dealing with today, correct?
Correct. However, the GHKCU peptide is blue, but it doesn't turn your head blue or anything like that.
Well, that's good. Well, so for the layman who's hearing peptide for the first time, what is a peptide, compared to, say, a hormone, in comparison to how should they think about it, about how they're going to help treat their own hair loss?
So peptides are short chains of amino acids, right? You can think of them as very small building blocks of proteins. Peptides act as signaling molecules in your body, and then they regulate a whole range of your biological processes, including cell repair, inflammation, hormone function, tissue regeneration. Peptides are endogenously made by your body, okay? So they're natural substances that our body already produces. As we age, the number and amount of peptides that our body can naturally produce declines over time. And so by supplementing with peptides, you can then ask your body to perform those functions as they were when you were younger. So that's kind of like an easy way to kind of talk about them. Once again, small little chains of amino acids, small little proteins, naturally occurring in your body, naturally produced in your body, that can affect all the various physiological functions.
So with them being, obviously already existing in our body, they're a natural substance. Why is there some concern over the use of peptides in today's day and age? Like, why is it not a mainstream, pretty, recognized on every street corner type of treatment?
You will certainly be hearing more and more about them. There's going to be an explosion in peptide therapeutics over the next few years. Peptides as of now are just not very regulated. All right. The FDA is actually, has this kind of unknown stance on them at this point. They've actually banned the manufacturing and compounding of many of these peptides. There's a whole research peptide gray market that's kind of sprung up online. And then it's also just, peptides, most of them do need to be injected. And so that's obviously, a barrier of entry to a lot of people to inject yourself, several times a week. But, they are effective. They are safe when used properly under medical supervision. They are safe when you kind of get them from compounding pharmacies and doctors that kind of prescribe them. They're not completely innocuous, as in you really do need to know what you're doing. And, but yes, they really represent a very fascinating and very effective kind of novel therapeutic category that I think a lot of us will be hearing a lot more about in the near future.
So as far as the role of peptides in skin and scalp, I mean, you've touched on that a little bit. It sounds like, as far as allowing the peptides to interact and engage with the cells and basically, expedite the role of the growth of the hair itself. Can you give us a little bit more detail on the skin and scalp dynamic?
Yeah, I mean, some of the peptides, some of the more commonly used peptides, like BPC-157, thymosin beta-4, GHKCU, these things, in short, they reduce inflammation and they increase the amount of blood supply, right, or increasing angiogenesis in the areas in your body, or when you do them systemically, or when you apply them topically as well.
So what's your preferred method for helping support the hair growth? I mean, there's obviously a ton of different peptides out there. And as we talked about, there's only a handful that actually influence the hair in a particular way. So what's your preferred delivery? Or is it a combination of things?
If you're looking specifically for hair regrowth, like we do actually do microneedling of peptides directly into areas where you want hair regeneration. So at Extension Health, we do microneedle exosomes combined with peptides. Sometimes we even do stem cell injections directly into the scalp and then microneedle a combination of exosomes and peptides to kind of produce that effect. Systemic application of peptides can also help with growth as well. A lot of people use systemic injection. You inject BPC, TB4, GHK directly into, your belly, that can kind of reduce inflammation throughout the body. Can that also be helpful for the topical system in here? Yes, it can. For more kind of, localized delivery, I would say you would inject microneedle directly into the area, or you can actually use topicals like GHKCU. It is effective as a topical. And so we do have creams that combine GHKCU, a anti-inflammatory tripeptide called KPV, and rapamycin actually as a cream that you can actually apply topically that I think can also help with hair regrowth.
Well, so in this, I mean, there's a lot of different products out there that say they have peptides in them, and they're basically utilizing that. They sell them on Amazon, or, obviously there's oral supplements like the BPC 157 that you can take orally. Do those work, or is that just kind of a marketing thing?
Yeah. I mean, oral BPC 157 really just works on the GI tract. Okay. It is, not very well orally bioavailable. And so I would say that's one thing. I've seen copper peptide, this GHKCU, now being like put into all sorts of, more commercially available products. GHKCU is a peptide that can be more topically absorbed. Peptides, when they're very small, okay, like when they're just much smaller amino acid fragments, tend to have better absorption when you kind of use topically. That's why we use something, KPV as an example. It's a tripeptide. It's a really good anti-inflammatory that I believe has topical absorption, but some of the bigger molecules, I don't think can be applied topically.
Okay. And the rapamycin, I mean, I do remember that was something I think it was Brian Johnson was taking orally. Was that orally or was it injected?
No, rapamycin is almost all of the time an oral drug. It's we use it in the longevity field. It's a senolytic. It's an immunosuppressant. In the longevity field, that's something that we use a lot. It promotes autophagy, cellular cleanup. Can potentially improve the longevity of the stem cells in the follicles. It has been shown in some studies to reverse skin aging and potentially stimulate, hair follicle cycling. In animal models, I don't think that's really been proven out in human studies so far. Rapamycin is, one of these topics that is widely discussed for many years now. Is it useful as a longevity agent? I personally think it is. If you can tolerate it without any side effects. I've, been taking it for 5-6 years at this point. I put a lot of my patients on it, an oral tablet once a week. But, as a topical, okay, rapamycin in these kind of lower concentrations, we use for the skin. And I do feel like that helps. Can we use it for the hair as well? Yes, I think you can. Okay. Once again, I don't think there's a lot of real great human clinical studies on humans, but biological plausibility is kind of what we think it should help.
Well, in some of these things, I mean, you look at some of the anecdotal things that come out early on, and, sometimes they say there's no way, this is going to work. And then obviously it does. And then there's something that I remember when they were trying to, about 10 years ago in San Diego, they were trying to put together a injectable to grow new papillas from stem cells and clone stem cell injections. And, with $1 billion investment, they just recently packed up the last set of microscopes and, sent them out the door. So it kind of from what you're saying, there isn't necessarily a lot of research on humans, but the plausibility of it doing a tremendous amount seems like it could do, a substantial amount for supporting hair growth. And especially when you've optimized already everything that's in your blood nutritionally, and, you're on the right supplements and you're basically doing all the right things. It's going to, in my opinion, I think there's a ton of support for this pathway. Because most people don't want to get a hair transplant. Most people don't want to fly to Turkey and, basically get 8,000 grafts harvested in one shot. To me, this is the future. And I love the fact that you're experimenting A little bit, but this is something you do yourself. So it's not like this is new to you. This is something that you've worked on and you've optimized your health. So, I mean, there was a little bit of a time not that long ago that the peptides and the change in your body stimulated how you started treating people. Is that right?
Yeah, totally. I mean, I was, dealing with a lot of my own kind of personal health issues that I just really couldn't figure out great solutions in the conventional medical system. I mean, peptides, they changed my health pretty dramatically, and that's kind of how I really got into this, and kind of being a real, spokesperson for it. As in, we've treated thousands of patients at this time with, peptide protocols, and we know how they work and know what the kind of clinical boundaries are. And it's a lot of this is just through experimentation, not personal experimentation, but also at this point, me and my team of doctors have treated many people. Yeah.
Okay. So somebody comes in hypothetically, let's just say they're in their mid 40s. We'll go with a male first. They've already done finasteride. They may have about 15 years worth of hair loss and, receding hairline, a little bit of the crown issue. And they're like, look, doc, I want more hair. What can you do for me? What would be your general idea of what the next steps would be? How long would it take? That sort of thing.
Of course. I mean, it's hair loss is like so multifactorial. You got to really obviously look at, all the hormones. You got to look at your inflammation, whether you have any autoimmune issues, balance your nutrition, your hormones, making sure you have, enough iron, vitamin D, thyroid, insulin resistant, elevated cortisol. Like after all of that is kind of like optimized, then you would start thinking about, hey, what are some of the interventions that you could do here? We've seen success with, back in the days, we were injecting PRP into the scalp. And these days we've kind of really moved on to, using exosomes. And so exosomes and stem cells, you could actually inject stem cells directly in the scalp, and then you would microneedle the exosomes on top with a combination of BPC-157, TB4, and GHK-Cu. And so we have seen that help, typically patients would come back every 4 to 6 months for a few treatment cycles, but we do have kind of before and after is kind of demonstrating that can be effective. One of the things that I think is a little unique that I've developed here at Extension Health is we like to stack treatments. And so there's a procedure that I do, which is called the neuro reset. All right. It is a injection here in the neck. All right. It's an injection here in the neck at the stellate ganglion, which governs your sympathetic fight or flight response. Right. When we inject that with local anesthetic, what it does is it causes a sympathetic blockade to the head and neck, which causes a lot of vasodilation. Okay. Well, you basically vasodilate and send a lot of blood flow to the head and the scalp. And then you do this procedure, you get better results. Okay. Because, poor scalp microcirculation is a cause of hair loss. All right. Reduced blood flow limits nutrients and oxygen delivery to these follicles. So when you vasodilate the scalp, and then you do your stem cell exosome microneedling procedure. And then afterwards, you send them to a hyperbaric chamber, right? So you kind of then blasting these cells with pressurized oxygen, 100% pressurized oxygen. That's what I feel like, you can use physiological changes to produce the most desired results. So once again, it's a shot in the neck. Sometimes we do it on both sides to vasodilate, send more blood supply. Then you do the microneedling procedure or stem cell injections, and then you send people to the hyperbaric. And so that 1, 2, 3 kind of combo, is what I, as an anesthesiologist, I like physiology. And when you think about what cells, what stem cells, what just hair follicles need to perform optimally, it's simple. It's blood supply and oxygen, right? So how do you get as much blood supply and oxygen to the cells, to the follicles? And that combination, I think, is it's what we do here.
And if you're dealing with hair loss or hair regrowth issues, definitely go to advancedtrichology.com. It is the go-to place to stabilize and understand why you are losing hair, because you're an individual, just like we're going to talk about today about peptides. Not every particular product is right for you, but Advanced Trichology is going to do some diagnostics to find out what's going on with you. You can also get blood work there. You can get a customized particular protocol just for you, as well as find packages that are neatly going to help support your hair regrowth, stop the hair loss, stop the shedding, and get as much hair back as possible. I love that stack. Actually, in the last episode, I talked about my perfect protocol, which is not, into this realm. It was using low-level laser therapy, discussing exosomes along with PRP and microneedling, but you've just taken it to the next level. And I mean, the way that you're discussing the improvement of blood flow to the scalp is so novel and, makes so much sense on how everything would be improved because of that. And then you're reinforcing it with the hyperbaric oxygen. And do you just use a 2.1 ATA?
Yeah, any medical grade 2.0 atmospheres and above. One session is good, but yes, you do need to do multiple sessions. So ideally, after a procedure like that, you can spend an hour a day in the hyperbaric for a week, for 10 sessions. Like, that's going to get you the best results. The hyperbaric is not readily accessible to a lot of people.
Humans. Yes.
Yeah, but we have a lot of patients just installing hyperbarics at their home. They, they sleep in it, sometimes. But hyperbaric is one of the most kind of really efficient anti-aging kind of modalities that I think exists out there today. So I'm a big fan of hyperbaric oxygen therapy. Yeah.
Well, yeah. And for 120 grand, you can have one, in your home. So it
can be a lot less than that these days. Yeah.
Okay. Well, that's good. The price is coming down. So you ended up developing this block for pain originally, right?
Yeah. This is a pain management procedure. It's because the original, it's called the stellate ganglion block. And we were using it in pain management for upper extremity pain, sympathetically mediated pain. A lot of pain is kind of from the sympathetic nervous system. So this has been around for a long time. Several years ago, I really got involved with using it for PTSD, okay? Because when you interrupt the sympathetic nerve fibers, it really can help with PTSD symptoms, all right? People in PTSD have an overactive sympathetic nervous system. Their systems are just overactive. And so, a lot of research has been done on like military trauma, veterans, that's a very useful procedure. So, I was one of the kind of original doctors along with, Dr. Lipov and the Stella Center to kind of really get into that. I set up a whole interventional mental health division, kind of focused on PTSD and treating anxiety with these blocks. And that's kind of subsequently evolved over the past few years. This is a procedure I really like doing. Now we actually involve a vagus nerve injection in addition to the sympathetic nerve blockade, because the vagus nerve governs the rest and relax state, right? Where the sympathetic nervous system is a fight or flight function. And so how can you kind of augment both states at the same time? So you block the fight or flight, and then you try to improve the rest and relax state by injecting the vagus nerve. And that combination we call the neuro reset. And so here at Extension Health, we're kind of doing research on that vagus nerve injection. And we've seen thousands of patients for that. A lot of people kind of fly in for that treatment specifically. Kind of drifting a little off topic here. I apologize about that, but it's one of my passions. And so, I like talking about it.
Quite frankly, though, I think it just really points to you as a human. I really feel that most physicians, when they get into medicine, they have this true desire to change things and be innovative. And unfortunately, I feel like a lot of physicians end up, kind of getting lost in the mix, whereas you are still on track and you're continuing to be innovative. You're obviously not only helping people with PTSD, but, other stress management issues. Have you ever used this for, say migraines or anything like that?
Yeah. It's like migraines is that's a different one. It's tinnitus, migraines, craniofacial pain. It's helpful for long COVID, dysautonomia, POTS, MECFS. A lot of traditional medical training just really kind of neglects the autonomic nervous system. the autonomic nervous system is actually really responsible for a lot of stuff that's just not like really focused on in traditional medicine. So, yeah, thinking outside the box of like what other things can you kind of improve upon? Like that's kind of one thing that I've been kind of a little more in tune with these days. Migraines a little tough. Migraines are so multifactorial. If it's like sometimes vasodilating can actually make migraines worse sometimes. So you got to be careful with some of these things. We still today don't really know what injecting the vagus nerve does. All right. We have a clinical study ongoing right now, kind of looking at HRV, parasympathetic scores, kind of all the different functions of what happens when you actually inject the vagus nerve. The answer is we don't necessarily know. I've done several hundreds of these cases. I think it does do something. I think you get better results when you inject the vagus nerve along with the stellate ganglion. But what exactly, we're still really trying to delineate. There are case reports of hydrodissections of the vagus nerve helping with chronic widespread pain, fibromyalgia, things like that. But once again, more studies, more data needs to be done. And so it's exciting. I like to, think outside the envelope, kind of, be inventive in medicine. Medicine is traditionally very stodgy, very specialty limited. You're kind of trained not to think outside the box. But I like pushing the field forward in whatever way I can, right? Yeah.
Well, without stepping outside the box, you can't be innovative. So you got to do what you got to do. Getting back to hair. So somebody comes in, so you're going to do the block. Theoretically, you're going to go then, obviously, exosomes, stem cells. You're going to do, maybe BPC and the additional items either injected into the scalp or applied topically, microneedling, and then, hit the hyperbaric oxygen. So after that, then what? Do you put them on some topical peptides, or you just hang out and wait?
Yeah, no, I would then, afterwards, I would do systemic courses of these peptides. Okay. Like you would do a systemic course. I would do a 3-month course of a BPC TB4 GHK. All right. You can consider adding on some of these growth hormone stimulating peptides, such as CJC, ipamorelin as well. That can help in addition, because by boosting growth hormone levels, you can stimulate IGF-1 that can help improve your VEGF, your vascular endothelial growth factors, along with kind of, other systems in the body. Just having a little extra growth hormone promotes hair follicle growth, right? And so those are potential kind of add-ons, synergistic, systemic kind of applications of peptides that you can do on top. Obviously, continue your hyperbaric sessions, things like red light caps, all that stuff, that can certainly also be beneficial as well.
It's interesting you touched on the growth hormone. Obviously, you're talking about peptides to stimulate growth hormone. Whereas I remember 20 years ago when we were in the clinics in Arizona, particularly, there were a couple young gentlemen that we were treating, and we were using oral minoxidil, topical minoxidil, finasteride, lullaby laser therapy, all the things, nutritional supplementation. And there were a handful of guys that were on HGH at the time. And, they were doing it to build muscle and to just basically be better in the gym. But there were a handful of cases. I swear they had the most insane results I had ever seen. And so, which totally supports what you're saying, you stimulate that growth hormone and then you're doing everything else on this stack. And then even adding lullaby laser therapy in small quantities and everything else, then, you might end up with more hair than you had originally. You're pushing the boundaries, right? Like you're pushing the growth cycle to its maximum capacity.
Correct.
That's very cool.
Yeah. Using HGH straight human growth hormone versus, using the precursor stimulants. That's a whole nother topic of discussion. I personally prefer using the stimulants. You get just much 100%. Less side effects. It's just safer. You're just worried about much less. HGH, straight HGH is going to work better. There's definitely a higher side effect profile associated with that. Yeah.
Okay. What are the things that, people should be wary of when they're trying to select peptides? Obviously, if they go to, extension.health and they find you and go through the normal protocols to get involved in peptides, I mean, that would be the most suggested route. But for those who might not have access to you and they see some of this, shiny objects on the internet, what do people need to be looking out for, to be wary of in the peptide field?
I mean, I would work with a clinician or a clinical team that has experience and knows about peptides and getting them from reputable sources. I would recommend that people don't buy research grade peptides. Okay. I have personally seen real issues with that. They are not produced in pharmaceutical conditions or commercially produced. A lot of them are from China. They can have a lot of different additives, heavy metals, all sorts of stuff in that. When you're injecting something into your body, you really do want to know about the source. You really want to be careful about, the source and the cleanliness and whether it's coming from, a compounding pharmacy. Like the FDA is around to protect us. As many gripes as I have about the FDA, it's still there to protect us. And yeah, we get peptides from compounding pharmacies. You're welcome to work with us. We do telehealth for people in all 50 states, extension.health. We do have these peptides available on our site, ext.health. We do ask that you submit medical information, and we do want to do it properly. We do want to make sure that you're a good candidate for these things. And, but the beauty of it is they're simple. All right. BPC, TB4, GHK, almost, I'll be very honest. Okay. As a doctor, almost everyone can be on these. There are very few side effects. It's very hard to overdose on these things. So they are really quite safe. All right. So the kind of procedure for obtaining these peptides is not complicated. We do a simple peptide consult. You can actually apply any kind of consultation fee to the peptides. We ship and deliver peptides all throughout the 50 states. Yeah.
So going out on the non-androgenetic pathway of alopecia. So you've got, say, alopecia areata or scarring alopecias like frontal fibrosing alopecia. Have you had any experience with those?
Hair loss is not like one of the main kind of things that we do. We use exosome stem cells very extensively in orthopedic applications. For some of these cases like that, we have done cases like that. It is more of a injection based technique. All right, like we have injected multiple different kinds of stem cells and different kinds of exosomes directly into areas of alopecia areata and things like that. On that case, there are some kind of peptides I didn't necessarily mention, such as thymosin alpha-1, that can be helpful for these autoimmune related hair loss cases like alopecia areata. You can combine them with the other TD4s and things like that. But thymosin alpha-1 as an immunomodulatory and anti-inflammatory agent can also be helpful in that regard.
I have diffuse alopecia areata, so I'm thinking, might have to throw that in there to see how that goes.
Yeah, a little thymosin alpha-1. It's anti-inflammatory, immunomodulatory. It could be helpful. Yeah, it could be helpful.
Now, there has been something in the news that has, really has been hyper pumped, at least through certain channels related to hair. And I believe it's the PP405. Apparently UCLA has discovered this. They're in phase 2 FDA clinical trials. And everyone's saying it is the cure for baldness, which I've heard, 1,000 times over the last 25 years. What are your thoughts?
Yes. I mean, I've got to know about this. It's by Pelage Pharmaceuticals. It's a, topically delivered small molecule peptide that works on this WNT pathway agonist. It's designed to kind of regenerate the dormant follicles. This is a critical pathway for initiating the kind of the anagen growth phase in hair follicles. And so, yeah, the preliminary clinical studies kind of look quite promising. It's currently in development. It's a UCLA spin out, as you said. And it's just another really kind of novel kind of peptide pathway that can be very promising in the future. Yeah.
And peptides, I mean, it sounds like there's just so many different paths that it can be utilized for regenerative medicine, longevity, so many of these things moving forward. Myself, I've got, a genetic medical condition that really has sped up a lot of things and created some bizarre attributes in my body. And as I look at what peptides can do, I think, this is the future. I mean, this is very, very cool of what's happening. Related to some things of your patients and your results, can you give me, a handful of things that you may have seen that you were just like, wow, I can't believe this happened when it comes to results with peptides?
As it pertains specifically to hair or just kind of
what? Hair, yes, but also I'm curious. I mean, I love science. I'm fascinated by all these things. So maybe one in hair and then one in a really cool alternate space in the body.
Yeah, I mean, honestly, with just simple basic peptides, you can really transform physiology. All right, a combination of a GLP-1 plus a growth hormone booster plus a mitochondrial peptide plus an anti-inflammatory, like just 4 peptides, you can really transform someone's health. All right, and so there's multiple stories of just physical transformations, better metabolic control, better hormonal control, less inflammation. I mean, these cases we kind of deal with on a day-to-day basis. Peptides can even help with mental health. We have a whole interventional mental health division. A lot of peptides and some of the interventions we've been, I actually just posted yesterday using some of these peptides and neuroresets to get people off of benzos and, antipsychotics and antidepressants. Peptides, body produces like 7,000 different kinds of peptides. We're literally right now just scratching the surface. Okay. As AI advances, we're going to be learning so much more about how proteins fold, what kind of different peptides target different kind of receptors. The future is really, really bright. And we're just at the very beginning. So, the commercially available ones now, we are only really limited by like 15 different peptides that we can work with. But that number is due to explode. Very targeted pathways, stacking modalities, stacking different peptides. We actually have these stacks that I'm developing right now, stacks of peptides that, you combine 4 or 5 different peptides and you engineer them so that they're stable in solution, that they don't have any kind of receptor interactivity, that they're pH stable in solution. But, mixing 4 or 5 different peptides together in a stack is obviously going to be a lot more helpful for the consumer that doesn't need to draw out from 5 different bottles and inject themselves 5 times a day. So a lot of new technologies coming out, pens, different delivery systems, buccal films, sublingual drops. We're working on a lot of these newer delivery mechanisms. The future is exciting in the peptide world.
That's awesome. And I'd love, if you don't mind, just for the people who are viewing this, if you've got some before and after photos, I'd love to be able to, put them up through here, just for hair purposes and show off some of your results. And, with some of the things you talked about stacking, talked about injecting, I believe that the standard protocol is basically 5 days on and 2 days off. And you kind of then take a month off depending upon, which peptides you're on.
Yeah, I mean, the typical peptide cycling is 3 months on, 1 month off. That applies to some peptides. GLP-1s do not need to be cycled off. You can kind of continue them. Growth hormone peptides should be cycled on and off. Mitochondrial peptides should be cycled on and off. There's kind of like little nuances to how you use all of these.
Which makes sense about why you have to have some supervision. You have to have a medical provider that's taking care of you and making sure you're doing the things correctly.
Yes. That's that. I think that's important. Work with someone that really, everybody is a very individualized N of one. You really do need to, look at your blood work, look at your hormones, your inflammation, your metabolic profile, how your mitochondria work. All right. Like when you kind of know all these 4 things, then you can develop a protocol specific for, what you want and what your body actually responds to.
Yeah, absolutely. Well, I think we've covered the vast majority of the items that we really wanted to go over. I mean, you again have done so many really, really cool things when it comes to the future of medicine and setting it up. And I'm so appreciative of your time today. I just a plug for you. Obviously, if you are looking to do something, related to peptides, whether it be a cream, whether it be injectable, whether it's not necessarily for hair, definitely go seek out Dr. Kuo, because he's the guy. I mean, honestly, I'm sitting there at Don't Die Summit, and he's literally half the people in LA are standing there wanting to speak to him. And it was a very interesting whole format. He's on stage with Brian Johnson, going over these really cool, innovative things that he's doing, as well as, again, I got to really say how impressed I was when you were sitting there with Dr. Mark Hyman. And really, you're working with some of the most respected people in the industry. And I think if anyone was going to go somewhere to go get some peptides, it should be to you at Extension Health. I may or may not have had a consultation with you. It's just throwing it out there. He's definitely a resource. And if you're going to do something, do it with Dr. Kuo. So that is how I'm going to sum this up, because you're a revolutionary physician and I love it. Thank you so much.
Thank you. I'm glad. Humbled. Thank you. We're all just learning. The field is brand new. There's a lot of things that we don't know. We're all just trying to figure it out together. Had the pleasure of, sharing my knowledge. My goal is to share my knowledge with everyone, and kind of just let as many people know that these new therapeutics really exist and they do work. Democratizing knowledge is one of my missions. Yeah.
Fantastic. Well, and you're humble. So that's even better. So if you want to know more about Dr. Kuo and Extension Health, down in the show notes, you can check that out. Direct link to his website, and you can go obviously meet with him or one of his physicians. And again, thank you so much for being with us today.
Thank you so much. It's a pleasure to be here.
Obviously, after this great discussion about peptides, go to advancedtrichology.com, go up to the link, take the quiz, understand why you're losing hair, set that foundation of stabilizing your hair growth, maximizing your hair growth through supplementation, topical applications. And if you need low-level laser therapy to support your hair growth, you can do that too, all at Advanced Trichology. And obviously, if you need to take it to the next level, definitely go check out Extension Health and see Dr. Kuo, because all of these things together are going to support the thickest, fullest head of hair. So go check out both advancedtrichology.com and extension.health. It was so great to have Dr. Kuo today. For those of you who are out there, you're listening to this, you're always trying to advance your hair growth. I really, really hope that his insights gave you some insights on peptides. Obviously, there was a tremendous amount of information there, but definitely check out the show notes for more information on Dr. Kuo and Extension Health. And we are going to continue to bring you this cutting edge information. We're looking at talking more about exosomes, more about integrating, the more traditional methods of low-level laser therapy, advanced trichology, nutraceuticals, and topical products into your particular protocol, and to find the best way for hair growth for your particular situation. If you love this podcast, which I really hope you do, go ahead and give it a 5 stars. If you are listening to it on any podcast platform, please go ahead and give it a 5 stars. Subscribe to what we're doing. This is what we want to feature for you, the best way to get your hair back and the best way to regrow hair. So please go ahead and do that. And I will see you on the next episode of the Trichologist Podcast.